Hello, and good evening once again. Dr. Alalade here at Ask the Gynecologist. I'm quickly checking my audio levels here, and this is a wonderful day. If you're watching me, I'm sure you've realized that for over 7 days now or so, I've not been online. I've been busy daily with basic stuff, which I will let you know definitely as we continue this discussion tonight. And obviously you can see a tiny pimple on my face. Obviously, I think it's because of a bit of stress, and it's amazing to have that. So thank you guys for joining tonight. Once again, my name is Dr. J at Ask the Gynecologist, Dr. Alalade, Dr. Babajide Alalade at Ask the Gynecologist. First of all, I want to say thank you to everyone that has celebrated with me, with my family, most importantly, and most especially with my wife on the delivery and arrival of our daughter. It's a daughter, and it's a wonderful, beautiful girl, and it's a wonderful time. It's a wonderful time again to be a dad, and I pray and I use this delivery as a point of contact to every woman and every man and to every family out there looking for similar blessings. I pray that Almighty God would not delay your blessings, and that angel of mercy, that angel of blessings on its way to deliver answers to your prayer shall be swift and shall be on time to deliver to you your own blessings without delay by the grace of God. And if you believe that with me, say amen to that in whatever way you can, with faith, I mean. Thank you so much. And definitely, I've been a dad before. I have 3 children. And as most of you that have been listening to my story know, I've been married before. I was divorced. And from that previous marriage, I had 3 children. I had 3 children, 2 girls and 1 boy. And I got remarried again about 2 years ago, exactly 2 years ago. And it's been a challenging time. Separated, divorced, I say, for 7 years before I got remarried again, and to start all over again. And it's very difficult when you are not able to see 3 of 3 children that you have, that you look after, that you send money to every month. You can't talk to them, but that is life. But it's an opportunity to tell you that you can start again. You can start your story again, and you can rewrite your story. Never leave the pen of your life's history in the hands of anybody, whether a man or woman or anybody. It doesn't matter. Always hold the pen to your history with your hand and rewrite your history at any point as you want. Okay, that is the first thing you must always determine to do. And the most important thing in life is that nobody owes you any form of happiness. You owe yourself. You owe yourself every form of happiness. That's number 2. Number 3, most important. Number 3. Remember again, number 2, nobody owes you happiness. You owe yourself happiness. You owe yourself happiness. And number 3 is that always remember one thing, that you were born happy. Every person born in this world, no matter your circumstances, we are sometimes born into circumstances which we can't change, but everybody was born happy. Happiness is inherent. We learn to be unhappy, so we can relearn to be happy. Okay, and through my challenging times in 2011, it peaked in 2015 November when we started ATG. ATG is actually a child brought forth through my struggle, through my difficult times personally. And during those times, I found God on my own terms. And it's until you discover God on your own terms, you are not really working with God. When you discover God in your own terms and you call God the name you want to call God because of your circumstances, that is when you actually know the true God. And that true God is always within you. And it's just for you to learn to reconnect and to connect back to that vibration and to that powerful God Almighty within you. I always tell people all the time, I don't want to know what God looks like. It's not my business. People have come before me and they'll come after me. They'll try to discover and want to know how God looks like. It's not my business. People keep on trying to discover God. I don't want to know how God looks like. Whether God is a man, whether God is a woman, whether God is anything. It's not business. But what I know is that there's God. Where that God is, I don't want to know. Okay? You don't know where electricity came from. You don't know what it looks like, or you might not know what it looks like. But if you put your hand on a naked wire, if you put your hand and you stuck your hand mistakenly into an open socket, okay, you get shocked and you get a vibration from that electricity. And you know in reality that that light is true and is there. The same thing with God. It's a force. It's powerful. She's powerful. It's powerful. I don't need to know what God is, but my whole job is to know the laws that govern how I can contact that God. And throughout my existence, I want to ensure that I live my life in harmony with his laws or our laws. And that will make me a better person if possible, all things being equal. So that is what I always want to know. And if you at home today, you're trying to listen to me, please keep to that and try to discover God on your own terms. Don't call God anybody's name. Call God your own name. The God of so, and so. My God. If you can call God your name, that is when you really know God. If you can't call God by your name, my sister, my brother, you still have a long way to go. Okay, and on that journey, which we all go through at different point in time in our life, that journey, nobody can take you there. When I was going through my own challenges, difficult times in marriage, 2009, so 2011, 12, 13, it was a difficult time. Sometimes I just wish that everything ended. But I just have that yearning within me that I'm still here to fulfill my obligations in this world. And I want to do that consistently. And my desire on this earth is to be able to put joy across to every woman, joy across to every man, joy across to every couple that desires that change in their home, that wants to add 1 or 2 children to their home. And by the grace of God, that journey, that vision we have together here in ATG will be fulfilled without delay. So thank you everyone again, still sharing congratulations to me on this live page. Today's discussion is about the sort of infection that can cause miscarriage. So if you're just joining for the first time, you're on Instagram, you're watching us here live on YouTube, and you're watching us live on Facebook, welcome once again. I want to say my name is Dr. Alalade, Dr. Babajide Alalade. Thank you, Adeni, you blush babes. If I haven't mentioned your name, please apologies. I'm just trying to talk. I'm trying to show for my appreciation. So if I've missed your names, don't take it personal. I'm just trying to quickly get things across. By the way, if this is your first time in Ask the Gynecologist, I want to tell you that you are at the right spot on internet, on social media. This is the page you have to be as a woman on in today. If you have not joined this page, and if you have not shared this page to your other friends, to your church members, to your friends in the mosque, to your friends in your Rotary Club, to your friends in the market, to your friends in business, share this page with them and let them know that in ATG we talk about the gospel of women's health. And that gospel of women's health is what we preach here to everybody, whether you're a boy or woman, whether you're a man or anything, it doesn't matter. Whatever your age, we are here for you. And so most people have sent messages to me on Instagram, on Messenger, on our email. They want free consultation. It's difficult, okay? It's difficult to provide free consultation to 1.7 million people asking at different times. It's difficult. That is why we come here to talk about things like this live freely. But if you want that one-to-one consultation and you want to take me away from looking and gazing into the beauty of my beautiful wife and beautiful daughter, it's okay. I have to take time out of it. So therefore, I won't need to get paid for that. So if you want free one-to-one consultation, you can't get it free. You have to pay for it. It's what we call premium services. So if we've not replied to your direct messages to us on Messenger or direct messages here on Instagram, it's because it's not free. You're listening to me like this now. You're listening for free. And I'm willing to do that. Yes, I'll tell you the things I know clearly, concisely, the things you will pay for your doctors anywhere in the world to get. But we give it here free. But if you want that one-to-one attention with me or with Dr. Esther, you have to pay for it. And we have what we call the premium services. And we have the weekly premium consult. We have the monthly consult. We have the gold, which is for a year. We have the diamond, which is for a year, the platinum service is also for a year, with different things add-on that comes on with them. And on this page right here, all our moderators, including Christina Oladumoye, they're already sharing information as per our services. And if you're pregnant, I always tell people, if you're pregnant, don't wait until you have a miscarriage before you get registered. If you're pregnant, you quickly register for the antenatal service. In fact, if you're trying to get pregnant and you know that you're pregnant, don't wait for miscarriage. Miscarriage will not be your portion. Just go and register for antenatal services quickly. Dr. Esther will look after you there. And it's going to be on a general group on Telegram. That is the antenatal group. We also have the GTC, the Getting Ready to Conceive group. GTC is Getting Ready to Conceive. It's also a group, open group on Telegram. Okay, and Dr. Esther is also handling that, handling that. But if you want that one-to-one consultation about time you get pregnant, okay, you go to the premium services. Or if you have any other gynecological problems, definitely go through the premium services. Are they doing Jimo? You're wonderful. Also, if you're watching me here, okay, please subscribe to our ATG YouTube channel. It's free. Okay. By the way, the ATG YouTube channel is free. Okay, and what happens in the channel there is you watch my videos sequentially, chronologically, and if you've missed my video on general group like this, just go to our YouTube channel ATG, subscribe there. You always get notification whenever I go live or whenever I've published a video there, and you can watch everything that we've discussed. By the way, you know, this month, next few weeks, next few days in June, we're going to open the ATG IVF Center. And the ATG IVF Center is pioneered and powered by the ATG Women's Health Foundation. And that is the system, and that is the group foundation that runs the ATG IVF Center. And the ATG IVF Center is going to be promoted by the ATG Women's Health Foundation on YouTube, on Facebook, live regularly. Because that program, that foundation, helps to support that ATG IVF Center, which is a totally different company entirely, okay, and it runs quickly, and people are already signing up for the 2 IVF Circle Bonanza, and we're going to stop that soon because it's taking a huge cost from us. So we're going to, because we've totally stopped that anyway. I've told my secretary that she stops the Bonanza. Okay, if you've registered for the Bonanza, the 2 cycle Bonanza, very good. If you've not registered for the Bonanza, just pay for the IVF 1 cycle and you'll be looked after when we open next few months, next few days. It's going to be open in June. So today, I'll be talking about what sort of infection in the vagina that can cause miscarriage. So if you're with me, thank you and settle in to listen to this discussion today. So thank you once again for your congratulations, for your celebratory messages. Yeah, thank you, Adeni, you blush brides, Ewalua. Thank you so much, my wonderful, beautiful sister. Ewalua blush brides. She does all this makeup to make you look beautiful. In fact, by the time she does your makeup for you, it's as if you've never been yourself before. She's going to exhume and bring out the permanent beauty of God within you. Ewalua is a wonderful artistic person, and she does that very good. I've watched her programs, I've looked at her pictures, the things she's done, and she's a busy lady. And when you want to get things done, give it to a busy person. Ewalua, she knows what she's doing, and she's going to bring out in you that Ewalua means beauty of God. And in fact, true to her name, Ewalua blush bright, she will bring out the beauty of God totally from within you and make it into reality. So welcome once again, and thank you everybody once again for congratulating me and my wife, most importantly, and then me on the arrival of baby. It's been busy. You know, when you are in the abroad, in quotes here, you don't have all the Omugu and all people helping you around in Nigeria. It's just you and your wife. So, you know, in the abroad, as a man, you have to be hands-on. So I've been busy washing bottles all over again. The last time I did that was about 9 years ago. So I'm back again to the business of washing, feeding bottles, mixing milk at night, and feeding the baby twice at night, you know, waking up again and having sleepless nights. But it's wonderful. It's wonderful to gaze onto the life of a new person and thanking God that from within you, something came out from you that made this baby who they are. That baby you're looking at is just half of you and half of somebody else. It's a miracle of creation. It's a miracle of creation. So you know, by being a parent, you're partaking in the creativity and in the enterprise of creation that God has put within us. Yes, Esther, Dr. Esther, I'm washing the bottles. I'm washing the bottles to ensure that there's no colic, because colic is something that makes the baby cry all night. And this baby, when she wants to eat, she eats like anything. And the way she eats, this baby, she eats like the daddy. She eats, and the amount of milk she eats, it's increasing every day. As in, the first night it was 30 meals. The second night it was 30 meals consistently for day 3, then from day 4 move to 60. I'm like, this baby is gulping down this milk. And I can tell you, I'm in the business again of buying milk, supplementing to supplement once in a while, because this baby eats like her father, and she's so strong. When she moves like this, and she's like she wants to punch me, I'm like, I have to put on my guard. She's wonderful, she's beautiful, and she cries out her lungs, and I'm happy, and I'm grateful to God to be a daddy once again. It's been a long time, and I always pray to God that I enjoy this opportunity to carry a baby again, my blood, myself, and it's an amazing time once again. So thank you everyone for your understanding. At ATG, thank you most especially Dr. Esther. Dr. Esther has been holding the fort, even without me telling her. She's holding the fort in ATG, and she's doing an amazing job. Dr. Esther, I want to say thank you so much, and most especially as well to all the ATG ladies. So our ATG ladies, I'm going to call out names one by one. To all our ATG ladies, our moderators, you've been amazing. You've totally something. I tell my wife that you guys bring tears to my face. All of a sudden my wife had to be induced. I was just finishing up 4 nights on call. Then she was induced. I couldn't go home after that night shift, and the induction was carried on for about 48 hours. I was on labor ward after my own normal on call. I was starting another family on call there until about the 3rd day we had to baby came out. So it was a long time. And to everybody waiting to tap into this sort of blessing, I say by the grace of God, your desire will not be delayed, and God will bring your desire into reality, and God will bring that power into you. That power of creation that God has invested in you shall not be put to shame, and God Almighty will cause you to smile, and will put all people and every people trying to mock you to shame. Children will run around your table. Children will make noise in your house. You see, my house has been too quiet for long, and when I see this baby making noise and crying to eat, it makes me happy that God can bring such a cry in my home. It's a blessing that the baby can pee on my bed. It's a blessing that I have to be cleaning the poo from baby's butt. I love it because it's a beautiful thing. I wanted to do that. I love to do that because babies are gifts from God, and God will not deny you of that gift. We are parents, we are custodians of the mercies of God. We are only custodians. These babies are not ours. They are given to us by God, and we are custodians of them. And at some point they will grow up, they'll marry, and they'll move on. So I want to say thank you everybody in ATG for celebrating me. Thank you everybody for bringing joy to her face and making my wife smile. She's been so inundated with so many messages, people saying thank you to her, congratulations, so on and so forth. It's a wonderful thing. We give glory to God Almighty. Don't worry, once the pictures are out, I'll share them to everyone here. It's an ATG baby. It's a girl, and the name is Michelle. I'll let you know as things develop here with every other thing that is important. So, and that is always important as well. So thank you everyone, to Dr. Esther, to all the ATG moderators. Okay, I don't want to mention names, or if I start mentioning names, I might forget names, and people might take it serious. Okay, so I'm always shy when I'm talking here. I'm always shy, so I try to compose myself. If you know me, I stammer once in a while, but God has given me the grace to overcome that. If you know me, I'm a very, very personal person. I don't say things too much, but ATG, when I started in 2015 November, has brought out this power within me, the power and ability to talk even before I want to talk. And God has been so faithful that once I open my mouth, things start coming out, and these things are edifying and they change lives consistently by the grace of God. So today let's talk about what sort of infections can cause miscarriage in pregnancy. It's difficult to get pregnant for some people. Now, they get pregnant and they have miscarriage. It's annoying, it's painful, it's disastrous. The first thing I want to say is that if you have a miscarriage, okay, statistically, 1 out of every 4 pregnancies will end up as a miscarriage. In some cases, we can't prevent obvious reasons for miscarriage. Okay? How did you know my daughter's name? Somebody's already putting my daughter's name already on the screen. Michelle. Subomi Adebanjo. Thank you. Well, the girl's name is Michelle. I don't know how that lady knew about my daughter's name. Oh, that's my Subomi. Okay. Anyway, thank you guys. So that is Michelle. Michelle Alalade is the name. I was trying to keep that secret, but they've already put it out in the open. Yeah, that's Michelle. Michelle. And if you see her hair, it's like, oh, her hair is beautiful. And I look at it all the time, and I just kiss her forehead. And God Almighty will bring such joys and such blessings to every woman out there desiring this sort of thing in Jesus, by the grace of God. So that's Michelle Moradeke Alalade. Michelle Moradeke Alalade. So yes, you can call me Daddy Michelle. That is me. And that is an honor. And that is God's given honor. And I take it and I enjoy it. Thank you so much. Okay, let's start. So, if you have a miscarriage, first thing I always tell people is that don't blame yourself. There's nothing you've done or there's nothing you should have done that you didn't do that might have caused the miscarriage. Don't blame yourself. Okay? Sometimes miscarriage could happen even after you've done everything properly. You've done everything you're supposed to do. Despite that, miscarriage happens. Don't blame yourself. Definitely, it's heart-wrenching, it's gut-wrenching, it's painful, and most women will cry. Definitely. Okay? But it's okay to let out the negative energy. Yes. But don't give up. The fact that you have a miscarriage also says that you are able and God can do it to carry you from that state to deliver your baby. And in most cases, like we always say on ATG, most causes of miscarriages is what? Chromosomal abnormality. And when I say chromosomal abnormality, these are things that are not preventable. Like Down syndrome, sometimes, but most babies with Down syndrome, they'll be born alive, to be honest with you. But there are also chromosomal abnormalities that are totally incompatible with life. And those babies will miscarry because there's a fault in the genetic makeup and nature wants to start again. Secondly, if you have a miscarriage, it's not because of a sin you've committed. I know as a Nigerian, we're very religious people, and I think apart from Indonesia, we're the number 2 most religious country in the world, if not number 1 by now. At some point 4 or 5 years ago, Nigeria was the number 2 most religious country in the world. It is not because you've committed a sin. Pastors have miscarriages. Mommy mission, they have miscarriages. People that are sinning don't have miscarriages. And some people that are so bad and they are so invested in what we call so-called sin, they've had miscarriages. And I've seen people that are so, like, you think they're devil incarnate, if there's a devil anyway. You think they are so wicked and yet they will have babies as if they are popping out poo consistently. So if you have a miscarriage, it's not because God hates you. God will not give you a gift and want to take it away. So miscarriage is not because of anything you've done or something that you should have done. Okay? Miscarriage can happen to anybody. But the most important thing is that if they happen, how do we deal with them? How do we handle them? It's always important that men stand by their wives. My father will always say, if you are interested and you're able to go and pop out a girl's pant and you put your something inside, you put your snake inside, be ready to take the consequences. So if you're a man, you got a woman pregnant, a woman has given you a body to give her pregnancy, you got her pregnant, be ready to take the consequences, whether good or bad. So if on this side of our discussion, the woman you got pregnant had a miscarriage, always stand by her. I know for some reasons we are not at home, at work, but as soon as you are able to, whether on the phone or on video call, as soon as you're able to get there, if possible, hold a hand. Most men going through miscarriages, their heart is torn. Almost 90% of people going through miscarriages, their heart is torn. You see, my last on-call duty, before my wife was induced last week, the first patient I saw on that on-call duty, this woman was 38 weeks pregnant. She came in that night, yes, That's Sunday night. Our waters broke. As soon as we came, we saw her, we scanned her, and there was no heartbeat. The first doctor that scanned her, very lovely guy from Croatia, he called me in. Jay, come quickly, come. Because they called me Dr. J at work. I came in, they said, Jay, can you scan this thing? I can't see anything. So I introduced myself to this couple, very lovely family. I scanned the pregnancy, the woman's tummy. I could see the chest, the ribs. You could see the ribs shadow on scan. But as soon as I did that, there was no heartbeat. So I put on the Doppler. Doppler color flow helps you to see heartbeat. Okay? I couldn't see anything. I couldn't see any cardiac pulsation, we call it, on scan. So I looked at them. I see they already knew that I was coming with that news. I said to them, I'm sorry. I'm sorry to be the one bearing this news to you at this point in time. This baby is not fine. When was the last time you saw this baby move? They said the day before. That was on a Saturday. They were out on a dinner. They were seeing families and friends, but the baby was not obviously moving. They was too busy. On Sunday, no heartbeat. Water came out. They came to labor ward. That baby was dead before the baby was born. Did that baby commit sin? No. Did the parents commit sin? I don't know. But that's beside the reason. I've seen babies die before they are born. I've seen babies die on their birthday. I've seen people that are born and they are old and their organs are failing, yet they refuse to die. Everything is in the hands of God. God gives, God takes. So don't say if anybody is committing sin by having a miscarriage. If you don't know anything, keep your mouth shut. If you can't make people's life better, keep your mouth shut. Shh. So we talked to the lady. She delivered the baby the following day after we induced her. When the baby came out, the locker was foul smelling. The baby's body was macerated, which means that probably the baby died even about a week before then. This now gives me the important info to you today that in pregnancy, the only reliable indicator of child's well-being is the baby's movement. When my wife was pregnant, I always ask her every morning and night, even on text on the phone when I'm at work, are you feeling baby move? Not because I'm afraid, not because I'm panicking or worrying, not because of fear, but because I want to reassure and I want to be reassured. Baby's movement is the most important factor, the most important thing that the baby is healthy. And you should at least aim for one movement every hour for at least 10 hours. So every hour of the day that you're awake, maybe you're awake for about 8-10 hours during the day, you want at least one movement, minimum every hour. Sometimes you get more than that. Some people say, doctor, my baby is moving too much. There's nothing called baby is moving too much. Nobody runs around the racetrack 24/7. They will rest. I cannot run around the track for 24 hours. I have to rest. Okay? So babies do rest. There's nothing called excessive movement. No, baby is moving or it's not moving. If your baby's movement pattern has changed, let us know. Some babies do change their movement pattern maybe from day to night because they are in their own world. So if your baby's movement pattern has changed and you're not happy, go to the hospital. Let them check you out. You don't scan. Simple as that. It won't take too much time. If you're not sure of baby movement or baby's movement has changed to what you're normally accustomed to, go to hospital. I saw a lady, I think the day before that, this one died. That lady was 22 weeks pregnant. She came to the hospital. Doctor, I haven't seen my baby move. I don't know what's going on. So I scanned her. Baby was moving up and down. The husband was there. I reassured them. And she now said, I hope I'm not bothering you. I said, you're not bothering me. If your baby is not moving, the only place you should be right now is here. If your baby is not moving, as I told her, you're not going to go to Tesco. Tesco is a big supermarket store here, or Asda. I said, if your baby is not moving, you're not going to go to the bank. You don't go to Asda. You don't go to Tesco. You're going to come here. And it's my job to scan your baby, to make sure your baby is moving, and to reassure you. So I checked the baby movement, the placenta, I checked the weight, the blood flow in the cord. I reassured her, and she was happy. And I told her, if at any point in time you're not happy with the baby movement, call me, call us, come to hospital. Let us check you and reassure you. That is why we are here. And I hope that people are following this. So, after the episode of that woman that lost a baby at 38 weeks plus 3 days, the night went on busy. And as God will have it, the last patient I saw that day, 8 o'clock in the morning, before my wife came for induction in my stomach at my hospital where I was working. That's where my wife had the baby. She was induced there. Okay, so 4 o'clock in the morning, this couple came. They are from Turkey. The woman was bleeding. I spoke to them. They had IVF in Turkey. They flew down to UK because they are resident here. So I spoke to them. I realized that I knew that they got IVF, but they've never had a scan because they came down here immediately after their IVF in Turkey. So I scanned her, and lo and behold, they are twins, DCDA twins. And she thought she was 10 weeks pregnant, but lo and behold, she was 12 weeks pregnant. And you can see the two babies jumping up and down, playing, punching, having fun. I told her, from her crying, thinking she's lost one baby, she's happy. And you can see her face change from sorrow and cry and being downcasted to happiness and joy. All of a sudden, she was happy. And as fear of losing one became the joy of having two. So I told them, haven't you had a scan before? They said, no, they've never had a scan. They came here immediately to UK immediately. And this is the first scan they're having. They're happy. That gave me a closure for me as a doctor from the painful experience of this couple that came initially and to this joyous one. As a man, it's important that every day you ask your wife that is pregnant, are you feeling baby movement? It's reassuring. It's a bond of love. It's a bond of support. It's a bond of faith to your pregnant wife. Children are part of men are part and parcel of children as much as the woman is part of them. And every parent, man or woman, has a role to play in the life of their baby, of their children, of their babies, of their offspring and progeny. You have a role to play. If you don't know it, discover it today. And it's been written down. Discover it. Your job as a parent is a guardian, as a custodian. Children are not your own. You don't hold them. You don't own them. The only thing you hold them is love. Your children don't need to love you, but you must love them. Your children don't need to love you. That's the truth. But you are obliged as a parent to love them, no matter what may. That is why I remember during my experience. Let's just move on to this topic and continue. So if you're pregnant and you are worried about any infection, the infection you should be worried about in pregnancy is bacterial vaginosis. I'm going to put it up on the screen here. Bacterial vaginosis. Bacterial vaginosis. If you're watching me now, I know if you're watching me now, I know that my writing here on the screen is backward. By the time we repurpose this talk on YouTube, it's going to be the other way around. So don't panic at all. Bacterial vaginosis. This infection is notorious and it has been written down in many papers all over the world as the #1 cause of miscarriage in pregnancy outside chromosomal problems. Don't forget I was talking about chromosomal abnormality, that you can't prevent them. They happen and they come, but they don't happen recurrently. Very rare. So the #1 cause of miscarriage outside chromosomal abnormality is an infection called bacterial vaginosis. Outside pregnancy, bacterial vaginosis is not a big deal, apart from the fact that it makes your vagina very, very uncomfortable, very, very sore, and makes you prone to other infection. Bacterial vaginosis in pregnancy is #1 cause of miscarriage in pregnancy. And if in pregnancy, if you've had a miscarriage before, okay, and you get pregnant again, you should always ensure that you get swab taken to check for any infection in your vagina, most especially bacterial vaginosis at each trimester. Each trimester means each 12 weeks phase of your pregnancy, from week 0 to 12 or 13, from week 14 to week 23 or 24, and from week 24 to around week 36, 37. Always have swabs taken to check for bacterial vaginosis. And if it's there, we treat it as soon as possible, because this infection has a way of damaging the membranes and infecting the baby and causing baby to be miscarried. If you're being treated for bacterial vaginosis by your doctor, it's also important that after you've been treated, you go and repeat your swabs a week or 2 after the treatment to ensure that it is cleared. Number 3, if you've had treatment for BV, we call it BV, bacterial vaginosis. If you've had treatment for BV in your pregnancy, It's important that you watch out for any sign of offensive vaginal discharge during pregnancy. Number 4, if you've had cervical sacrilege or any infection in pregnancy before or in your current pregnancy, you should always be conscious of any form of offensive discharge that could be possible infection like bacterial vaginosis that should be treated urgently and promptly if it's there. Is somebody hearing me? Is somebody listening to me? Is somebody listening to me? Okay? This infection, if it's found in any pregnancy, must be treated. And if you've been treated before for this infection, bacterial vaginosis, you must ensure that if you notice any offensive discharge, let us know. Sex in pregnancy does not cause bacterial vaginosis. Poor hygiene in pregnancy can cause bacterial vaginosis. Bacterial vaginosis does not cause infertility, but it can cause miscarriage in pregnancy. Again, bacterial vaginosis is not a common cause of infertility in pregnancy, okay? But it's a possible cause and is a common cause of miscarriage in pregnancy. So if you're pregnant, screen for BV. If you don't know what BV is, at every time you are pregnant, at least in your first trimester, second trimester, third trimester, get screened for BV. If you don't know what trimester is, listen, no big deal. It's not even a big science. Week 1, as soon as you know you're pregnant, you're in first trimester. When you get to 12, 13 weeks, end of first trimester. From 14 weeks to what? 23, 24 weeks, second trimester. Third trimester is from 24 weeks and above to end of pregnancy. Sex doesn't cause BV, okay? BV is not caused by sex. But if you got BV in pregnancy or outside pregnancy, it can make you prone to other infection. Is somebody listening? I know we have questions here, but I'll start taking questions shortly. So please hold on. I know you got questions right now, and I know you want to ask questions, but hold on. I'm going to take them one by one. The ATG IVF Center opens this new month of June and is being sponsored by the ATG Women's Health Foundation to ensure that people get IVF cheap and affordable as much as possible. We've taken off the 2-cycle bonanza. It's now 1 cycle. If you're going for ATG IVF, it's 1 cycle, 1 cycle. If you want 2 cycle, you pay for 1 and 1. Okay? 1 cycle, 1 cycle. The 2 bonanza is over. Okay, I've already informed my secretary because it's a huge cost on the medications. Okay, so if you've not booked, sorry, you're running late. So let's take on some questions now because some people are already itching to ask questions anyway. And if you're on Instagram, now we open the floor for questions, so you can ask your questions on Instagram here. I will answer you. If you're here on Facebook Live, the floor is open for questions. Let's start listening. Abigail Itoha is saying that how can one stop recurrent infection? Ensure that you maintain proper and very, very good hygiene vaginally. Wash front to back. Don't wear one pant every time. Okay? Use all 100% cotton pants so that there's hair blowing into the cookie. And the cookie is well maintained with hair. Okay? Awele is asking, you had a miscarriage last year, August, and up till now, you've not been able to get pregnant. You had ovarian cyst surgery in February. During the ovarian cyst surgery, was there any complication? And if you're not able to get pregnant from August last year, it's almost 10, 11 months now. You should get all your fertility tests done. Go back to drawing board. Let's do all your hormonal profile, everything. Ultrasound scan, HSG, go through your information, what was done during the operation in February, and know whether you're ovulating. Also, check your husband's sperm count. Don't forget that there are also men. Concerning the movement, is it normal to feel movement only at the abdomen? Where do you feel movement? Do you want to feel movement in your mouth? I'm just joking. Anyway, when you're pregnant, the movement of your baby is in your tummy. It's not going to be in your bum. It's not going to be in your buttocks. It's not going to be in your chest. The movement of baby is going to be your tummy, and you'll feel movement from 21 weeks and above. Less than that, you might not feel movement. Some people they are professional. They can feel movement at 18 weeks. It's common if they had baby before. But most will feel movement from 21 weeks and above. Wilson Joe, you reside in Italy, you have a fibroid of 8 centimeters, you're trying to get pregnant. The other time, Dr. Esther came out online, asked this, and she said fibroid, but Italy doctor said, oh God, I saw net. Italy doctor said based on surgery, she advised you to carry yourself to Nigeria and get it removed by experts. So you try next month for it. Okay, so basically you have fibroid 8 centimeters. In Italy, they told you to go back to Nigeria to get your fibroid removed because it's too big or so. No big deal. That's fine. If your fibroid is 8 centimeters and it's so big, you're trying to get pregnant, 8 centimeter fibroid, trying to get pregnant, by all means remove it. Somebody's asking a question. What are we going to discuss on my profile? Okay, don't worry. Ask a question on Instagram. Let me answer you. Doctor, do all men have the same number of sex chromosome? What do you mean by sex chromosome? Every man that is a man is carrying XY chromosome. Case closed. I hope I answer your question. I'm not sure what you're trying to ask here on Instagram. Princess Khalifa, you had a miscarriage last year. They ran test on you on the pregnancy that you miscarried, and they said that oh, so I can't see it again. It's gone. Let this be slow. I can't read it quickly. It's gone. Well, okay. Let's come back here to Facebook. You feel movement around 2 to 3 months. Pastor in US, the doctor was shocked. Baje, you have to follow up. Okay, you can't feel move. Okay, well, you will see movement on scan from 5 weeks and above. You see baby moving, maybe from 10 weeks. In fact, from 10 weeks and above, you see baby moving on scan. Okay, but you won't feel it, because maybe it's not big enough for you to feel their movement. But by 18, 20 weeks and above, the movement will be so pronounced that you can feel it, that you can feel them, I mean. Okay, so Ashley Williams, I don't know, you feel pregnancy movement at 12 weeks, but if you feel it, that's okay. Can low sperm count cause miscarriage? No, low sperm count does not cause miscarriage. Staphylococcus aureus does not cause miscarriage. Staphylococcus aureus does not cause miscarriage. This is for Instagram. Low sperm count does not cause miscarriage. Songotola is asking, what does it mean to have fluid in the uterus? We'll talk about that shortly. Someone is asking a question, what does it mean to have fluid in the uterus? Okay, I guess you want to say, what does it mean to have fluid in the pouch of Douglas? We'll answer that here on this screen shortly. So I'll put it here so I don't forget. And that'll be the last thing we're going to answer before we close this talk tonight. Doctor, I feel movement in my stomach. You're not pregnant. What is moving? I don't know. If you are not pregnant, you're feeling movement, go and get a scan. Maybe you're pregnant and you didn't know you're pregnant. Okay, or do a test of pregnancy. That's for Glory Oga. Wilson Joe, how long can you wait after fibroid is removed before flying? How long can you wait after fibroid is removed before you fly? Most cases, once the fibroid is removed, I think you can, depending on your health and health circumstances, and depending on the complications and how straightforward the surgery is, you might be able to fly 4 weeks to 6 weeks after the surgery. Okay, but I'll suggest you have a consultation, an entire concise discussion with your doctor before you fly after any major operation, like fibroid. You have to have a discussion with them so that they can check you and okay that you're able to fly. I'll suggest give it 6 weeks after the surgery before you fly. And Morenike on Instagram, Staph aureus does not cause infertility. Morenike, Staphylococcus does not cause infertility. Staphylococcus does not cause infertility. How long can one start pregnancy after miscarriage? So if you have a miscarriage, once you have your regular period, you can start trying. As far as you're having a regular period, as far as you're psychologically okay, you're balanced, after miscarriage, there's so much trauma. Once you are okay and you feel confident and boosted and you feel happy enough to start trying again, then by all means try. You don't have to wait for anything. Okay, some people they want closure, some people they want time to heal mentally, some people they want to try as soon as possible. So you have to work with yourself and you need support around you before you take that step. Doctor, what can be done to stop miscarriages? You had 11 miscarriages, chromosomal abnormality, anti-nuclear antibody. So if you're having chromosomal abnormalities and you're having recurring miscarriages, what we usually do is to give you high dose of aspirin during your pregnancy, even before pregnancy, and also scan you consistently all through pregnancy to ensure we reduce the possibility and the chances of miscarriage. Okay, that's for Akimbo, Bishi, Temitope, Ajayi. You had a lap and die in the hospital. Lap and die is a test to check whether the tubes are open or closed. And your tubes were blocked. The doctor advised you to have IVF. But when I visited another hospital, doctor did lap and die test to correct the blocked tube, which was caused by infection. Well, Nanaru Combs Nankwat Sukuk Ibrahim, if you've had a lap and die test and they said the tubes has been blocked, then it's possibly true that the tubes has been blocked. And if your tubes are blocked, that doctor that told you IVF is actually right. If the tube is blocked or they are blocked, let's be honest with ourselves, there's a reason that tube was blocked. It's usually from a damage from possible infection in the past. And in most cases, if we try to unblock a tube that has already been damaged, they don't work. Most people either have a miscarriage or have an ectopic pregnancy, or it does not even get unblocked at all. And to unblock tubes, we do hydrotubation. People think it's the best thing to do, but in most cases, it doesn't work. It only works 1 out of every 4 people. But if you want to take a chances, by all means do that. But if the tubes are blocked, if both tubes are blocked, I would suggest IVF, to be honest too. That's for you, Naru Combs. God bless you, my sister. Somebody said, yes, thank you, Kende. Thank you, Christina. What causes yeast infection in pregnancy? Mame, what causes yeast infection in pregnancy is just pregnancy. Pregnancy itself is a state that changes the pH, the acidity level of the vagina. And it makes yeast infection that usually sometimes lives in the vagina without causing any problem to be more in quantity. The fact that you're pregnant is on its own a reason for your acid environment in your vagina to change. And it makes yeast infection very, very common during pregnancy. Okay? So that is yeast infection. It's common in pregnancy. Doctor, can injection correct? So someone's asking, Ogoma is asking that, can injection correct blighted ovum? No. Blighted ovum means that the pregnancy is not progressing, it's a miscarriage. Okay? Can we now give an injection to make that pregnancy that is already miscarried to become a live pregnancy? No. No medication in the world can reverse death. No medication in the world can reverse miscarriage. If you've been told you had a miscarriage and you did a scan again and then the pregnancy is now fine, in the first instance, it's either the fact that whoever did that first scan made a premature diagnosis. You never had a miscarriage in the first instance. But there's nothing God cannot do. Me, I'm not God. I'm a doctor. I only go by what I see value-wise, what I see in reports. If you were told you had a miscarriage and later on your baby is fine, that means that doctor that did the first scan or whoever made that first diagnosis made a wrong premature diagnosis. Maybe out of good faith, I don't know, but it was wrong. No medication will reverse miscarriage, okay? Can indigestion cause miscarriage? No, now. Indigestion does not cause miscarriage. What causes blighted ovum? In most cases, implantation failure, chromosomal abnormalities, which are usually not preventable and they don't repeat themselves in most cases. Sometimes infections, sometimes we don't know. Okay, now let's talk about, I'll stop taking questions now. I want to talk about pouch of Douglas. Then I'll close this talk this evening. Thank you once again for joining me tonight and talking about these things. It's a week I've been offline since pregnancy and since delivery. Now, if you slice me open like this, across like this, this is what, and if I was a woman now, this is what you see. You see my vertebra like this. Okay? You see the womb like this. That's the tube. That's the ovary. And then you see the bladder here in front of the womb. And over here, you see the bowels. Okay? So what it means is that there's a space here. And there's a space here. Okay? This space here behind the womb, between the womb and the bowel, is what we call the pouch of Douglas. Retrouterine pouch of Douglas. That's the full name. retrouterine pouch of Douglas. In most scans, they'll tell you that there was fluid in your pouch of Douglas. And people get upset, confused, and they are told that it's an infection and that there's wahala. Let me tell you something. Listen to me attentively tonight. Or another way I can do this, that if I draw a woman, okay, this is the woman's bum, this is her spine, this is the woman's tummy, and this is her leg. Okay, this is your bladder, this is your womb, and that's vagina there, and this is your bowel. Sorry, let us do this properly. So this is your bowel here. Okay. Now, there's this space here. This space here, number 2, is the same thing as this space here. This space is also here, number 1, and this is number 1. Okay. This space in between here, in between the bowel and the womb, is the same thing as called retrouterine pouch of Douglas. Okay, now if they scan you and they find fluid here in this space number 2, fluid here in this space number 2, and they tell you it's infection, that person does not know what they are saying entirely. Okay, nobody can diagnose infection on scan. It is not possible. But you could see things that could be suggestive of infection on scan. Maybe like a tubo-ovarian abscess or collection that are so thick, you think there's an infection there. Okay? And if we suspect infection on scan, there are 2 or 3 things we can do to confirm our suspicion. Number 1 thing is to take swabs from vagina to check for infection. Number 2 thing is to just go by our clinical suspicion. And when we see offensive discharge, painful cervix, that will give us indication that there's an infection. And we go on that notion alone and we start treatment because we don't want to waste time. Because if you don't treat infection in pregnancy, infection at any time in a woman, there's a risk of damage to the tubes or to the womb. And the last way to confirm infection, okay, not last, but one of the ways to confirm infection in any woman is if we've given you treatment and it's not responding, we do laparoscopy. We put a camera through your tummy to look into your tummy, into your womb, into your womb through hysteroscopy to check for infection through your womb cavity on hysteroscopy or infection in your tummy from your tubes from laparoscopy. We do all this to confirm infection. And if we see pus, we say, yes, this person has an infection. So if anybody sees any collection in your part of Douglas and they say they know that it's infection, that person is lying. That person doesn't know anything. Okay, we don't know. If they see fluid in your part of Douglas, but you have fever, you have offensive discharge, that could be true that you might have an infection. So we put all these things together in context. That's number 1. Infection. Number 2, if I see fluid in your part of Douglas, and I know that in your mid-cycle, you're on day 14, day 16, day 17, it could just be fluid coming from your ovary, from ovulation. Just post-ovulation. It could be post-ovulation. So if I see fluid in your part of Douglas, I need to take your history. I need to go and interpret this fluid in your pouch in response, in entirety, in context of what's going on with this woman, with this lady. Okay? And number 3, if I see a woman that is pregnant and I think she's advanced in her pregnancy enough for me to see pregnancy in the womb, and I can't see the pregnancy in the womb, and I've done tests of pregnancy, blood or urine, and it's positive, and she's in pain, her blood pressure is dropping, and I scan the woman and I can see fluid in the part of Douglas, that could mean that woman is having ectopic pregnancy that has ruptured and she needs to go to theater immediately. So when I see fluid in the part of Douglas, I need to interpret it in context of the patient's history and the patient's presentation to me in the emergency room or anywhere I see her. So just seeing fluid in the part of Douglas and saying you have an infection is nonsense. You have to interpret it in context of what it is. If you think it's an infection, do swabs, treat infection, or do things to confirm your suspicion. If you think it's mid-cycle, it could be ovulation, and it's not to go on its own. If you think the woman is pregnant or she's pregnant and you can see that the blood level is down, blood pressure is dropping, she's having pain in her right shoulder, she's feeling dizzy, and you can't see pregnancy in the womb or outside the womb or outside the womb, and there's fluid in the part of Douglas, that means she's having a ectopic pregnancy and she might die if you don't take action. I hope this is enough for you to understand tonight. I'll see you again tomorrow by God's grace. So we continue this chat on this channel. Once again, I want to say thank you everyone for being here again. And thank you for celebrating my wonderful daughter that was delivered a week ago. God bless you. And this sort of miracle and blessing will not be scarce in your homes. Thank you for watching, and God be with you and God bless you. Have a wonderful day. Have a wonderful rest of the week. If you're yet to subscribe to the seminar coming up this Saturday, the ATG seminar for people that are advanced in age, don't run too late. Today's already Wednesday. It's in a few days' time. For that seminar, it's going to be amazing. And if you attend that seminar, you're going to get some huge discounts for the IVF center that's going to open soon. So see you soon. Have a wonderful day. Have a wonderful week. And God bless you too much. And thank you once again. Bye-bye.